Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. Acyclovir, it is a pregnancy category B antiviral drug which acts mainly against human herpes viruses. It is acycloguanosin by structure. Guanosin is nothing but a nucleoside. Here it is acycloguanosin, that is not a true guanosin. It is just an analog of guanosin nucleoside. Coming to its pharmacology, it is available in oral tablets, topical and IV formulations. It is hydrophilic, so it crosses blood-brain barrier only 50% of that of the plasma volume. It also crosses placenta and is found in breast milk. As it is a category B drug, we can give safely to pregnants. Reaches peak in just 1.5 to 2 hours and stays inside the body 1.5 hours only. That is less T-half. So we have to give more number of times a day. That is usually we have to give 5 times a day. But for patients' convenience and this, we are giving 3 times a day. Bioavailability is very low, 15 to 30% only. Why? As it is hydrophilic, it is not completely absorbed well from intestine. That unabsorbed part is excreted through feces. It has low plasma protein bound. It is not undergoing any metabolism in liver. So in liver disease patients, no need to adjust the dosages. Mainly excreted via urine. So any investigation or monitoring we have to do is only RFT. Coming to mechanism of action. Acyclovir, after entering virus infected cell, it gets activated inside that infected cell only. Why? Because of the enzymes viral thymidine kinase, which is produced by the virus only. It converts acyclovir to acyclovir monophosphate. Then host kinases converts it to its active form acyclovir triphosphate, which binds competitively to viral DNA polymerase, which then incorporates this acyclovir triphosphate into viral DNA for elongation of the DNA chain and DNA synthesis. But here it leads to DNA chain termination irreversibly, inhibiting viral DNA polymerase. After reaching DNA, because it is not a true nucleotide, it completely shuts down the DNA synthesis mechanism. So no new virions will form, hence acting as a virostatic drug. And that virus infected cell will be taken care by immune system. Coming to FDA approved uses, it is used against human herpes viruses type 1, type 2, HSV1, HSV2, which are the causative organisms for herpes labialis and herpes genitalis. For primary episode, 400 mg TID for 10 days. Whereas in labialis, it is 5 days. Recurrent episodes, 400 mg TID for 5 days for herpes genitalis. For suppressive therapy, if the patient gets equal to or more than 6 episodes within a span of a year, we will start suppressive therapy with 400 mg BD daily for a minimum period of 6 months. Coming to next type, human herpes virus type 3, that is nothing but varicella zoster virus. For adults, both for zoster and varicella, it is 800 mg 5 times a day, 7 to 10 days. Usually varicella will be seen in children, where the dosage is 20 mg per kg. QID 5 to 7 days. Per dose, what is the maximum we can give is 800 mg. It is nothing but the adult dosage only. Coming to off-label uses, primary gingivostomatitis, herpes gladiatorum, recurrent herpes labialis, erythema multiforme, herpetic whitlow, herpetic keratoconjunctivitis, eczema herpeticum, Epstein-Barr virus associated oral hairy leukoplakia. For eczema herpeticum, we will give IV formulation. Adverse effects, it is well tolerated. As I already told you, it is having less toxicity. Only GI side effects are nausea, vomiting, diarrhea and headache, as it also crosses blood-brain barrier. Mainly crystal-induced nephropathy, which is fortunately reversible. That's why whenever we are prescribing acyclovir, we have to counsel the patient to take plenty of oral fluids, as it is eliminated via kidneys. Drug interactions, whatever the drug which is also eliminated through kidneys will be increased in serum levels when given along with acyclovir or valcyclovir, like mycophenolate, mofetil, or mycophenolate sodium. Whatever the other drugs which are also nephrotoxic, thereby if we combine this acyclovir or valcyclovir with them, nephrotoxic effect will increase. For example, foscarnet. Avoid live vaccines like live varicella, live zoster, because live vaccines DNA has to synthesize somewhat to stimulate our immune system. Our drugs are shutting down the DNA synthesis mechanism, so we have to avoid until 1 day prior the treatment or 2 weeks after the treatment to avoid vaccine failure. Only investigation we have to do is RFT, not LFT, RFT, as it is getting eliminated via kidneys. Remember the channel name. Don't forget to like, share, and subscribe. Thank you. Hasta la vista. Dasvidania.